Welcome back. Today I want to talk about patients that have a lot of dental problems. So I have my iPad here and I'm just going to go through a lot of the things that people will deal with or have to know about before they go ahead and get started with the treatment. The first thing that we want to talk about is sedation. So I don't have any representations in the iPad, but I'll just simply talk to you about it. You bring a friend. We give you some crushed up pills. We put it underneath your tongue and we let you sleep for about an hour. We kind of rouse you a little bit to get started, and then we get started with the work. And this gives us hours and hours of time to go ahead and get your work done, solve as many problems as we possibly can in one visit. It's a really productive visit. We really enjoy doing that kind of thing. But let's talk about exactly what we're going to do. And as I said, I've got my iPad here. We'll just go over some of those items, okay? So I'm just going to set here and start recording on our iPad. And the first thing I want to talk about is just, basic thing here. We'll come out of this orthodontics here. We'll go to decay. And interproximal decay is the major problem of dentistry. And so a lot of times what we're seeing is a patient is eating food and then the food is getting down in here. When that food gets down in there, bacteria comes and eats it. Okay, once the bacteria comes and eats it, they lay acid onto the tooth, and what you see happening here is that decay starts to form. And it can get quite severe. As you see, when it gets down to this point here next to the nerve, you're going to start to feel some pain. When it goes beyond that, it starts to be a situation where we absolutely must do a root canal. And this could be painful, painless, pain sometimes, pain never, pain all the time. It can present in lots of different ways, but that's the basis of what we attempt to correct in dentistry. Same deal. Let's just use this same artwork here. Let's throw that away. Let's talk about periodontal disease, which is an issue with the bone. Well, again, we're going to have food here. We're going to have bacteria come in, and then the bacteria is going to lay acid onto the bone, and you can lose bone that way. There are some other ways that you can lose bone as well, where there's trauma being affected onto the tooth, and we start to get chipping in this area, chipping here, and then because of the forces being so great on the teeth, we actually start to lose bone here. We lose bone in through there, and a lot of our patients that are experiencing this chipping, bone demineralization, and gum recession situation, we recommend them to get Invisalign and move the teeth back into place where the trauma stops. If we still have to do some work to kind of fix everything up, we may send you to a periodontist. We may try to put some bone there, but those things we try to stay away from. We like to just sort of stop the problem. If it's an aesthetic problem, it's something we can fix. We'll send you to a periodontist and may even consider things like crowns. Let's move on. When you have decay, one of the things that can happen is that you will need a filling. So let's talk about fillings. Very basic. Okay, this goes back to what we were saying. The acid has been left on the tooth, and we are going to then decide to take that material out. We're going to take that material off of the tooth, and then layer by layer, okay? We're also going to shine some light here onto the teeth, but layer by layer, we're going to fill in some composite filling material, which fills it out to the top, tooth colored. We don't even have the metal amalgam stuff. So that's what you'll see there. That's a filling. Let's say you have some slightly different problems. You may have cracks And let's even say you've got some decay around an old filling. There's just structural problems going on with the tooth, okay? You might need to have something called a crown. Now this is super dramatized, the one you're seeing right here, but you see some of that abfraction, that chipping going on. It's got a whole big chunk broken out of there. But what we're gonna do with the crown is we're gonna remove the enamel. Remove the enamel from the tooth and give it new enamel. And so you'll see that demonstration here. Enamel is removed. Then we start to put something on there called a core buildup, which normalizes the shape of the tooth so that we can put on our new enamel, which is a crown. Here's a picture of a crown. Okay? Proceeding onward, you can do 1 crown. You can do 28 crowns. All the way up, okay, and everything in between, okay? Some patients need 28 crowns. Some people need 10. Some people need 2. Most people only need 2 or 1. So that's what we're talking about with crowns. All porcelain material. We make it here digitally, so I can show you a little representation of kind of how that goes. We can do digital scanning inside the mouth. It gives us a digital readout. We send that to the lab. The lab makes this beautiful digitally made crown that doesn't degrade, that doesn't have shaping issues, that doesn't have fit issues, because in a digital world, nothing can get chipped or worn or anything like that. You just make it from the native resolution that the scan got originally. So we've got all those crowns that we could do. We can also do bridge work. So let's look at what a bridge is. Same concept as a crown. A bridge is 3 or more units or teeth that we're going to be doing all stuck together. And the idea is that you replace a missing tooth with the bridge. It's just 3 crowns. Same thing. Now, if you want to replace a tooth, the better option, not necessarily something you have to do, but the better option for such a problem when you're missing a tooth is an implant. When you have the implant in there, that means I don't have to touch these other 2 teeth. I don't have to do any of that. So the benefit comes down to putting a tooth back in where it was and just restoring the situation back to the way it was before. And then, of course, you can floss in here. That process takes about 3 months. You can go to work when you have that procedure done. It's not a big deal. Again, we're going to use digital scanning, and we're going to use a CT scan to put everything together to make a surgical guide, utilizing the power of computers to really help us do accurate procedures. Again, you can get 1 implant. You could get as many as 12. Okay, probably not going to have more than 12, because we'll just replace the other teeth in process of doing the implants. But it's not unheard of to have 10. And we have lots of patients that have 10 implants here. So that's the next evolution there. But these are the basic things that we do, including the sedation. So a person that's had years and years and years of dental work that just has piled up on them, and they need to get it done. They're scared to get it done. The sedation helps us get it done, and then it's just a matter of scheduling to get the work done, figuring out the logistics. Figuring out the logistics of getting it paid for, that kind of thing, which we have lots of options. Our front desk coordinators will go over those things. But this is special stuff. This is what will help patients that are afraid, patients that don't understand what's happening. This will help them to get into the dental office and figure out exactly what's needed, why it's needed. You've got a nice little primer. You can sit down with me or any other doctor and say, I saw this, I had a question about that, that seems reasonable. There's more solutions that we have, but those are the basic ones. Okay? See ya.